I am Bella Robinson. I'm the Executive Director of COYOTE Rhode Island. I've been a sex worker for 35 years, so I think that you could consider me an old pro. I had my first prostitution arrest when I was 18 years old. It pretty much sealed my fate into the sex industry, even though they withheld the adjudication. And this is pre-internet. But it's really easy to find out this information by public record searches, and nowadays policing with splattering names and photos all over the internet, it really doesn't matter if you get that arrest vacated later, because anyone that hires you can Google it and find out. So obviously you're going to be discriminated against. Not only did we do this Rhode Island research, after we got that data, I was data hungry. We surveyed 1,515 sex workers across the country with 145 questions. And in your packet, there's a letter from Giuliana Braun. She's at a conference, so she couldn't be here, but she wrote her thesis on the HIV and sexual health part. We found out sex workers had better condom use than the general public, but they were creating barriers because they couldn't be honest with their healthcare providers, because we're training the public to snitch on sex workers and call it trafficking without asking the person. There's a huge gray area in between. When a person can threaten to out you and have you arrested, get you evicted, and have your children taken away, it gives all the power to the predators. Our demographics is much different than Rhode Island. Recently, one of our people are going to talk about the massage raids, but we're seeing it policed, mostly street-based workers, Asian massage parlors. The police are engaging in sex with people before they arrest them and seizing their money. So I want to talk a minute about all these services and diversions and getting the police involved. It's called Law Enforcement Assisted Diversion, where the officer decides if you get lead. It gives, I'm not saying all police officers are bad, but it allows corrupt police officers to use this leverage. What we have found out nationwide, and we've studied this really hard in Rhode Island with every service provider, is none of them provide any service but directing you to a public shelter like Crossroads. So they have the same service as anyone can get from 211. What we think can help reduce trafficking is increasing subsidized housing for poor women, LGBT halfway houses, youth drop-in centers. There's things that we can do on this commission that make sense, that will make everyone safer. But before I close, I want to tell you about my last arrest in New Jersey 10 years ago. I was 44 years old. I was working with another woman that's 44. If two sex workers work together, they'd be charged with felony pandering and promoting, and you can understand why they would be safer if there's 2 or 3 women working together. But the laws around it are made to make our lives more dangerous. So we're 44 years old, and a SWAT team kicked in my door to my home with a ram, without a warrant, waving guns. I felt like I was a terrorist and the military was coming in. I was jailed for 90 days. The judge made me pay a $3,720 fine, and when I told him I had a 17-year-old daughter, I had lost my house in the recession, he did the math and said, you're going to pay $310 a month for 12 months, or I'm going to issue you a warrant. So I was basically trafficked by the state of New Jersey's courts. And the best way to find out if someone is being exploited or harmed or taken advantage of is not to ask the lawyers, not to ask the police, is to ask them their experiences. Thank you for listening.